The 87th Medical Group's motto is trusted care always, and recently they've worked to embody these words as their staff implements Air Force Medical Home.
It's team-based healthcare, so you have a healthcare team, and it's patient-centered, so that's where the patient-centered comes from. The whole team is centered around meeting the medical needs of the patient.
The goal is that every time you come into the clinic, you're seeing the same provider again and again. That continuity helps build trust between patient and the provider. It helps get the patient to know the provider and vice versa, and in return, you get much better outcomes.
One of the biggest challenges of implementation has been the Joint and Total Force platform environment here at JBMDL.
So we're the only tri-service joint base, which means we're taking care of Marines, Coast Guard, Army, Navy, everybody. And so that can lend to a lot of difficulties in time and how to get the records from different services, things of that nature. We also have a very large non-enrollee population here due to a lot of annual trainees come through, things of that nature.
Despite this hurdle, the airmen and civilians of the clinic have seen great success in numbers and attitudes in the past several months.
We've seen tremendous success in implementation. So our continuity, at our worst, we were about 40%. So about 40% of the time you would see your provider and your team. The other 60% of the time you would see whatever provider was available. In March and April, that was about 95 to 98% with your doctor.
There's a lot more cohesion. Everybody knows what's going to be happening. We have huddles every morning. That's something that was implemented with the Air Force Medical Home. And we have the team leads leading that, and it's a lot better now.
I've gotten a lot of comments on the way we've switched up scheduling, because it's opened up a lot of acute stuff. So we can see you pretty much the moment you need to be seen, and they'll come in and be legitimately surprised because it wasn't like that before. You'd have to wait like a week or two for something that probably wouldn't even last that long.
The whole idea between family medicine is that you really take care of the whole family. So not only are we taking care of the service member, you're taking care of their spouse and sometimes their kids as well. And we're just seeing patient satisfaction go higher, we're seeing provider satisfaction going higher, and then the outcomes already are showing improvement.